Hi, Dr. Wilson here talking about health checks again. So I've talked about women and men's health checks. You certainly can have health checks for different age groups. Make sure your children are getting in at least once a year. We used to just do them with the vaccines, but get in now that we tend to do that off to the side with the nursing staff, which is so great, gets you in quicker. I still want you to see your regular GP. I want you to get in with a healthy kid check. I want you to have their height and weight measured and make sure it goes up on the graph like it's supposed to. I want you to talk about nutrition. It's so vital. In the time when we've had the most access to the healthiest foods and known what we should eat is when we've been most confused, and unfortunately, in our fast-paced world, we've fallen back on believing the hype of certain marketing that has put out and said some foods are healthy when they aren't. Finding out that whole food, getting the fruit, the whole veg, staying away from packaged foods is vital for your children. They're growing a brain and they're growing their bodies. It's never more important that they are getting the optimum nutrition for their health, and that comes in food. It doesn't come in a package or a tablet. I want to find out that your children are doing well in school. That's okay to have a CBA. It doesn't matter. That's what I'm talking about. They're doing well. They're not being left behind. We're not missing a hearing problem or something like dyslexia. I want to know that they're sleeping well. It's so vital. This is when they're laying down their memories and growing their brains. I want to know that they're active. They need to be so active. Little guys need to be out running vigorously like little maniacs for 90 minutes a day. That's normal. Sitting down in front of a TV or a computer or a device for hours on end is not the normal. And in fact, it's changing where our children's brains are developing. We want to limit the devices and TV and computers and get them outside. Get them in the sunshine safely with a slip, slop, slap, and a hat with their friends, being sociable, energizing their brains and their bodies. It's so important. The other end of the spectrum as we're getting older, have you had your bone density test? Are we making sure we're keeping your bones as strong as possible so that we don't miss something? Don't want you to have a hip fracture and end up in hospital. I want you out on the golf course enjoying life. Are you getting, again, the nutrition you need, the sleep you need? Sleep changes. A lot of times the sleep reverts into something that's a very natural pattern, that's okay. But if it's a sleep pattern that you're not refreshed, then we've got a problem, and that affects everything from how we think, our memory, how well we feel, depression, anxiety, whether our insulin tends to go up, our sugars tends to go up. It affects everything. Are your vaccines up to date? The vaccine schedule keeps changing, so keep checking. Make sure that you're up to date. It's a simple question. It's a simple ask. May mean that you come back in the next week and get it done with the nurse, but that's fantastic. Let's keep you healthy. Let's make sure that we are keeping you fighting fit from day one to 100 plus.